In earlier times, our heroes held a cigarette in one hand and a drink in the other. Today, Olivia Newton-John tells us to get physical. And Diana Ross tells us she needs men with muscles. Times have changed for the better. And while there's a long way to go, the public has a better awareness of what comprises a healthy lifestyle today than ever before in history. Health professionals are placing greater emphasis on prevention of illness rather than on treatment after the illness exists. How did this change in attitude toward health care begin? Who's responsible? While no single person can take the credit for this important shift in attitude, there is general agreement that Lewis C. Robbins, MD, was and is the driving force of the movement which has come to be called prospective medicine. Back in the 1920s, Dr. Robbins was a student working his way through medical school. He worked as a first aid man at the Indiana State Fair and a lifeguard at Winona Lake. And even then, he wondered why they called his activity first aid. The aid provided was more like a last resort than a first anything. After medical school and residency, Dr. Robbins began his career in public health. The year was 1937, and the world was on the brink of war. Just as in warfare, Dr. Robbins saw the progress of a disease as an invasion by an enemy. He saw the population as victims targeted by disease. He spoke of diseases as an enemy with vulnerabilities. Dr. Robbins proposed that the invasion route of disease is marked by 3 crossings. The first crossing occurs when an individual invites the enemy to begin the invasion. People who smoke cigarettes, who drink, who overeat, have already made the first crossing over the load line. The second crossing occurs when an individual develops the disease. The war is now very dangerous, and the individual is at great risk of death. It is only at this second crossing that traditional medicine has been practiced. The third crossing is the Great Divide, death, when the individual leaves behind those who have his disease, but have not yet become casualties.
These 3 crossings are so important that the individual must learn how to command the crossing. We can leave the second and third crossings to the specialist if we can learn about the first or the load line crossing. We need only stay on the safe side of the load line, and we will never have the disease nor the death in the great majority of the precursors. Don't cross that load line.
Dr. Robbins saw many victories in this war against disease. In a chance assignment in the Public Health Service, he became involved in the landmark heart disease studies of Framingham and Newton. After Dr. Papanicolaou developed his excellent test for cervical precursors to cancer, Dr. Robbins pushed for the Pap smear to become a standard part of the physical examination for women. Dr. Robbins was involved in the development of the flexible colonoscope, which has made such a difference in the early diagnosis of colorectal cancer. By now, Dr. Lewis Robbins was chief of the nation's cancer control program with a budget of $10 million per year. But not all the battles were won. Dr. Robbins recognized the significance of the Hammond-Horn and Dorn studies of the 1950s, which addressed smoking and lung cancer. He worked diligently behind the scenes in the preparation of a first governmental paper on smoking and lung cancer to be released in 1959. In 1964, the Surgeon General's first report on smoking and health was issued. By 1967, the first warnings appeared on cigarette packages.
And it was this report of Robbie's which led to the publication by the Surgeon General at that time of this material, and resulted in the enactment of legislation which required the warning label on cigarettes. I don't think Dr. Robbins has ever received quite the credit he should have in this whole development of the awareness on the part of not only people but politicians of the ill effects of smoking cigarettes.
In researching the number of deaths caused by cigarette smoking and other disease precursors, Dr. Robbins studied the census tables. Seeking a more precise instrument, Dr. Robbins consulted specialists in probability, risk, and statistics. The result of this consultation was the now famous Geller and Gessner tables. The Geller tables show the probable cause of death by disease for age, sex, and race. The Gessner tables refine the assessment by establishing the risk factors for diseases based on an individual's lifestyle.
Shortly after I came on board, Robbie, he has all these ideas which he keeps throwing out. Robbie told me about an idea he had of trying to identify the major risks to an individual. He didn't believe that the periodic health examination was an effective way of prevention. So Robbie thought of this idea of picking various groups, people who were expert in the area of heart disease, of cancer, and asked them to come up with risk factors. We look at Robbie as the father of the health hazard appraisal.
To explain the concept behind the numbers, Dr. Robbins uses a true story about an English coal dealer back in 1873 who was committed to making merchant ships safer for British sailors. The coal dealer was Sam Plimsoll, and he saw cargo ships loaded with his coal sinking in storms at an alarming rate. In talking to seamen, Plimsoll learned that the ships were overloaded, and the result was not only a loss of valuable fuel, but a frightening loss of life. Realizing that laws were needed, he quit his coal business and ran for Parliament. After consulting with the actuarial experts at Lloyd's of London, Plimsoll was able to work out a mathematical model which could be translated into a load line mark on the hull of a ship. Load the ship so the mark sank below the water, and the ship was illegal and hazardous. Load the ship so the load line mark remained above the water, and the ship stood a much better chance of weathering the storms and reaching its destination safely.
The message it tells is, don't go over that load line. We can give medicine this visibility and language, something it does not have today. Don't go over that load line.
In 1968, Dr. Robbins returned to Methodist Hospital of Indianapolis. It would be here at Methodist Hospital that he would have the time and resources to refine health hazard appraisal. In 1970, Dr. Robbins, along with Dr. Jack H. Hall, published a book of major importance, How to Practice Prospective Medicine. This was a book by physicians, for physicians. It contained the Geller-Gessner tables. It outlined the entire history of and provided a workbook guide for health hazard appraisal. Since publication, thousands of doctors have developed a prospective view of medicine. The Center for Disease Control has adopted health risk appraisal. Nationwide, more than 130 commercial and non-commercial programs now bring health hazard appraisal services to the public. Still, today, in his 7th decade, there are many miles to go, and Dr. Robbins continues his war. Now, the major enemy is resistance to change. In the past, physicians treated illness, and patients became concerned about their health only after the second crossing, when the invasion of disease had already occurred. In the future, physicians will see patients in continuous and comprehensive care. In the future, the patient will become the decision maker, because it's the patient whose life is at stake.